common question that I get is, what would be an instance where somebody might use a wand instead of a dilator, or when would they be used together in the treatment of pelvic pain? And it is highly variable for different patients. I will start by saying that the intent and use of a pelvic wand is generally to address point-specific tender points or trigger points within the pelvic floor muscles themselves. So whether they are more superficial and close to the vaginal or rectal outlet or deeper in, generally speaking, you are addressing learning how to downtrain the pelvic floor muscles, so learning how to drop and relax them. You're doing pelvic floor stretches to help assist in the ongoing relaxation of the pelvic floor muscles, and then also working on elongation and restoring muscular length using the wand. That may be that is the only treatment that they need, and that by doing that, that helps to restore the pelvic floor muscle length, and then they have good coordination and they are able to relax to allow for penetration. If penetration in and of itself is painful or problematic, the dilator is an excellent tool. So our dilators come in a progressive range of sizes. Often you will see that with different brands as well, where we are working on the mind-body connection of relaxation and dropping and opening to allow for penetration, whether that's with a tampon, for a medical exam with a speculum, or with a partner. So oftentimes the indication for that dilator then is that they are learning how to train their brain to relax to allow for penetration to occur in a pain-free way. So dilators can be used alone if that is purely the coordination issue that you're trying to address. Dilator plus wand for treatment if there are tender points present and coordination issues, particularly when it comes to penetration. Wand in isolation if penetration is not necessarily a problem, or if the penetrative pain is deeper on penetration or due to tender points and trigger points that the patient cannot reach or relax. So that being said, those are not hard and fast rules. Oftentimes different patients are going to respond to different things, and the wand can certainly be used in the early stages as a type of dilator. You can see it's about the size of my pinky here. So for patients that are having a lot of trouble initially just working on the really superficial aspects around the vaginal opening, initially working on coordinating that relaxation and opening with their breathing mechanics, and then with other stretches and exercises conducive to what their individual needs are. And then from there, they can be using the wand to do some gentle stretching if they have stenosis or restriction in the opening there. For other questions, please don't hesitate to email us, and we can make more videos.